If you're feeling unwell or unsure about your symptoms, you don't have to face it alone. You can call NHS 111 and speak with a trained team of professionals ready to help you through your health concerns. There might be a short wait, but rest assured you'll be speaking with experienced clinicians. The trained team will ask you a few questions to better understand your symptoms and decide what's best for your care. To give you an idea of what to expect, Megan and Shannon are here to walk us through some of the questions you might be asked and why they're important.
Good afternoon, you're through to NHS 111. My name is Megan. Could I start by taking down your return telephone number?
Megan's taking a return telephone number so that if we get disconnected from a patient before we've got any other details, we can call them back.
And what's the main reason for the call today, please?
Megan's asking for the main reason of the call so that we can ensure if a patient has immediately life-threatening symptoms, we can deal with them appropriately.
Okay, can I start by taking your date of birth?
Megan's taking the demographics for the patient. That means that we're able to match them to the correct medical record and ensure that we're assessing them correctly.
So I'm just going to ask you a series of questions. Some of them may not seem relevant, but this will ensure a safe and accurate assessment today.
Megan's explaining to the patient that some of the questions we ask might not seem relevant because we'll ask a variety of questions, some related to the symptoms that they have and some that might not seem so relevant.
So do you have any of these symptoms as well as the abdominal pain, any vomiting or diarrhoea?
So Megan's asking some questions that are related to the patient's main concern. This is so we can rule out anything along the way to get them the help that they need.
Okay, so from the information that you've given me today, we do advise that you contact a local service within the next 6 hours.
So Megan's now completed the assessment with the patient. She would have gone through some further questions. The length of these questions and how many depends on what the symptoms are for the patient.
So from everything that you've told me, the most appropriate option is for me to book you in for a telephone appointment at your GP surgery for this afternoon. They will give you a call back at some point this afternoon within the next 6 hours.
So Megan's now referred the patient over to their GP practice for a telephone consultation. They could have been referred elsewhere depending on the outcome of the assessment. This could have been somewhere such as a pharmacy, urgent treatment centre, or a call back from one of our clinical advisors.
Okay, but if there are any new symptoms or your condition worsens, changes, or you do have any other concerns whilst waiting, please do contact us back at NHS 111.
So Megan's now completed the assessment with the patient and referred them on. She's given important worsening advice so the patient knows what to do should their symptoms change.